today to report about experiment number 3, which is all about hematocrit determination. Hematocrit determination, or packed cell volume, is a measurement of the ratio of the volume occupied by the red blood cells to the volume of whole blood after centrifugation in a sample of a capillary or venous blood expressed as a percentage. Now, let us see how Group 6 with Ms. Caroline Sulit to give us the materials to be used.
The materials to be used are lancets, heparinized capillary tubes, sealing clay, alcohol and cotton, hematocrit centrifuge. The PPEs to be used are gloves, mask, and lab gowns. The procedures to be followed during microhematocrit. First, you have to disinfect your hands, followed by wearing of gloves. State the clinical significance of the test. Disinfect the puncture site with circular outward motion. Allow to air dry to avoid contamination with alcohol. Gently prick the puncture site. Wipe off the first drop of blood because it contains tissue fluid that might interfere with the result. Fill 2 capillary tubes. Avoid air bubbles as you fill the tubes because it might give a false result. Slowly fill up the capillary tubes to avoid air bubbles or air space that may cause false result in the test. Be sure that the capillary tube is in a slanting position to ensure the good flow of blood. Properly seal the capillary tubes using initial and final sealing. This is to prevent the washout while centrifugation is in the process. Ask the patient to apply pressure using cotton balls. You may also tell that the patient may ask the nurse if the bleeding didn't stop. In centrifugation, ensure that you have 2 samples to balance it. Equal amounts of blood should be maintained to avoid breakage of the tubes. In placing the capillary tubes in a proper order at their respective numbers, you can find the numbers on the right side of the placed capillary tube. Ensure that the lid is tightly closed to avoid breakage of tubes. Turn on and set the centrifuge for 5 minutes and wait until it stops. Using the hematocrit reader, place the capillary tube at the center of the capillary tube holder. Ensure that the clay is not measured. You may put the clay below the line. Then, adjust the capillary tube at the level of where the plasma reaches the line. After measuring, you may now record the result. Make sure that you put the patient's proper name in the appropriate test.
Now, after seeing how hematocrit determination is being done, we will now determine the hemoglobin, which is the iron-containing substance of the red blood cell, is composed of a simple protein called globin and a red compound called heme, which contains iron and porphyrin. Ms. Jinky Tenorio will give us the materials and reagents for acid hematine method.
Materials: comparator, study pipette, and the reagents to be used are 0.1 HCl and distilled water. For the extraction of blood, syringe, tourniquet, micropore tape and cotton balls, and EDTA tubes. And the PPEs are gloves, lab gown, and mask. First, prepare the materials to be used. Disinfect your hands with 70% isopropyl alcohol. While wearing your gloves, you may state the clinical significance of the test. Make sure that the tourniquet application is not more than 1 minute. Examine the site and palpitate the vein. Cleanse the area in a circular outward motion and allow it to dry. And check the syringe. Make sure that the bevel is facing up. Slowly insert the needle, holding the needle firmly, and gently pull the plunger. And this is done to avoid hemolysis that might interfere with the test. Ask the patient to open her fist and remove the tourniquet and withdraw the syringe and apply with cotton. And ask the patient to apply pressure. Do not recap using both hands. Transfer the blood in EDTA tube in a slanting position. Do this slowly to avoid hemolysis. Invert the sample 8 times to ensure the proper mixing of the anticoagulant and blood sample. Put 1 NHCl up to the mark 2. Using study pipette, suck blood up to the 0.2 mark. Mix together the 0.2 blood and the 1 NHCl, then incubate for 10 minutes. After incubation, add drop-by-drop distilled water until the color of the sample matches those of the comparator. Now, you can see that the sample matches the comparator. Record the result, put the patient's whole name and test done for proper identification.